we have different hypotheses. We still strongly believe that antimicrobial therapy, when it's adequate, has an impact on mortality. Now, the second question is that, does this treatment has to be given within a short period? And so time to treatment, does this have an impact on outcome too? Can we just not rely on the use of a combination therapy as provided by the guidelines? And this is, of course, then the question of the need of documenting the pathogen.
The first one is a rapid, cost-effective, sensitive and specific diagnostic tool to identify organisms causing pneumonia, have a right potential to help the patient and to identify especially the patient with antibiotic-resistant pathogens. So this is the first point. The second point is if you find this kind of diagnostic tool, you have to perform high-quality research studies in order to demonstrate that this kind of tool has actually an impact on the patient's decision and on the patient's outcome.
When you look at what they achieved in terms of documentation, compared to the conventional technique, the PCR was giving twice much documentation compared to the routine culture. So this is quite interesting, and they were concordant with the conventional technique. But you see that this was associated with a change in the antimicrobial therapy in roughly 50% of their patients.
I was so sure that it was SARS-CoV-2 infections, but as you can see, this is a CT scan. It was not so typical for the SARS-CoV-2 infection, with a nice part of the lung with active infection. And when we performed the BIR, so we find out that this patient was actually having a Mycoplasma pneumonia infection.